much better. Okay, so again, you want to just do that on the other side as well, just to make sure both sides are good. Okay. Now, I'm going to have you on your back again. Okay, good. So this next technique is to normalize the lower GI tract or gastrointestinal system. Again, I need to go on the sacrum, so lift your hips up for me. Up, up, up. Oh, no, hips. Up, up. Yes, and down. Good. Very good. And then the legs are straight. So I'm going to go here onto the lower GI tract, and one hand is behind on the sacrum. Again, feel for your sacrum if it's moving nicely. We had it pulling us to the right before. Right now, as I'm feeling, it's moving very nicely, both into flexion or nutation and counter nutation or extension. Again, we're going to go indirectly or into ease. So if I feel the lower GI tract is pulling me one way or the other, I'm going to follow it. So if I'm going into ease, I'm going to go to the left, because on the right side I'm feeling that there's restriction in the lower GI. So you may not be able to see it, but my hand here on top is now going to go to the right. So now I'm going to go directly. And again, we're waiting for the fascia to release. Within the fascia, a lot of trauma gets stored, so we're just releasing that. Okay, and then there's the release. Good. Okay, so I'm going to just take my hand. Almost done, almost done. The next technique we're going to do is I'm going to place one of my hands on his diaphragm, on Omar's diaphragm, and on his esophagus. My other hand is going to go on the bottom portion of the ribs. And my hand's going to grasp around to the thoracic spine if I can. So what am I doing? I'm checking here for any diaphragmatic tension in relation to the esophagus, releasing it. And here I'm going to go, you could go into ease, but I'm just going to go directly. So into bind. And then you're going to check the esophagus in relation to the stomach and diaphragm. And then I'm going to check on the right side those ribs and diaphragm, how that's moving. Again, you're just following any fascial restrictions and release. And I can check if that stomach is curling and uncurling. It is, like it's supposed to. Okay. So that's good. So just to finish off, we're gonna balance the cranial-sacral mechanism. So again, I'm gonna go onto the sacrum and I'm gonna go onto his cranium. Yeah, we're gonna do that one. Okay, so once more on your back. Okay, your head's gonna go in my hand. And then lift your hips up. Good, and down. And down. Yeah, good. So I'm checking if the sacrum again is moving nicely here with the occiput. So they should move in unison. They have a pattern. Right? We want to feel that occiput go into flexion, and same with the sacrum. And we want to feel that occiput move into extension and the sacrum into nutation, counter-nutation, or extension. So flexion, occiput, and sacrum, and extension phase. Occiput and sacrum moving, and I'm feeling both. Both phases are moving nicely. Good. So that's just to balance the whole cranial sacral mechanism, which is a wonderful treatment to finish off with to balance at the end. All right. Good. We're done.